The fluorescent lights hummed their constant frequency above the ICU at Cedar Creek Medical, a sound most nurses stopped hearing after the first week. Brooke Sullivan had been there 3 months and still noticed it, the low electrical drone underneath everything else, underneath the ventilators and the cardiac monitors and the soft beeping that marked time in 5-beat intervals. 6 o'clock in the morning. The shift change hadn't happened yet. The hallways belonged to the night nurses and the early risers, and Brooke had always been an early riser. The smell hit her first, that combination of antiseptic and floor wax and something underneath it, something human and hurt. She'd walked into rooms that smelled like this before, in places where the heat pressed down like a physical thing and the dust never settled no matter how many times you cleaned. That was different. This was Denver. This was cold and clean and the kind of quiet that only came with wealth and good insurance. She pushed the med cart forward, her sneakers making no sound on the linoleum, and approached bed 7 without hesitation. Lieutenant Colonel James Hartwick lay unconscious, bandages wrapped around his left side where the IED had taken most of the blast. Baghdad, 14 days ago. 2 surgeries since arrival. His left arm lay across his abdomen, fingers slightly curled as if reaching for something just out of reach. The monitors above him painted a steady rhythm across the screens, oxygen saturation 86%, blood pressure holding at 104/62, heart rate 68 and regular. Not bad. Not good. Stable was what they called it, the word that meant alive but not thriving, conscious but still sleeping through the worst of the pain. Brooke leaned forward and checked the foresight on his right hand, the peripheral line running clear fluid at a rate that someone had calculated down to the milliliter. She made a note on his chart, vital stable, no overnight events, dressing intact. Her handwriting was precise. Every letter exactly the same size, every number positioned at the same angle. 3 months at Cedar Creek and the other nurses had already noticed. The way she charted. The way she moved. The way she never seemed to need to ask someone twice to do something. In the pocket of her scrubs, folded so small it nearly disappeared, was the flag. A burial flag, the kind that came folded into that tight triangle with the folds precise and deliberate, like origami made from grief. It had belonged to Sergeant Marcus Webb, Marcus's commanding officer before Hartwick took over the platoon. Webb had been KIA in Helmand Province, and some chaplain or someone who understood that these things mattered, had sent it with Hartwick's medical records, a note attached in faded ink, for his squad leader. Deliver when ready. Brooke touched the flag through the fabric of her scrubs, a habit now, something she did every time she approached Hartwick's bed. The patient didn't know. The colonel didn't know her face, didn't know that she'd served 3 tours while he was still in command school, didn't know that she'd heard his name in field hospitals and base break rooms as one of the good ones, the kind of officer who got his people home alive. She was just a new nurse at a Denver hospital. 3 months. Keep your head down. Do your work. Wait for the opening. She moved through the unit with the kind of efficiency that came from muscle memory. Room 8 was a post-op cardiac patient, stable, sleeping. Room 9 was a 72-year-old with sepsis, already on his 4th day of continuous renal replacement therapy, his kidneys giving up the way kidneys did when the infection got a head start. She noted his lab values, potassium climbing despite the dialysis, that particular flavor of failure that meant the downward slope was accelerating. Room 10 was empty. The unit had 14 beds total, 8 occupied, most of them the kind of patients who ended up here because they had insurance that would pay for ICU-level care and nowhere else to go. She was documenting vitals on the cardiac patient when she noticed the first discrepancy. The surgical log for Dr. Mercer showed a 12-hour procedure completed on Tuesday, the date marked clearly at the top of the page. Appendectomy. Routine, uncomplicated, minimal blood loss. She pulled the actual surgical notes from the chart, surgeon's signature at 7:32 and again at 11:16. 4 hours and 15 minutes. Not 12. The billing documentation, however, had the full 12 hours listed, marked with codes that corresponded to extended operative time, extended anesthesia, extended facility use. She made a mental note, the kind that didn't go in the computer, the kind that lived in the back of her mind where old training still knew how to track patterns. One discrepancy was sloppy. One discrepancy was human error. She'd keep watching. The next note was worse. A cesarean section billed for 8 hours. The actual surgery note showed 2 hours 40 minutes. She looked again, making sure she wasn't misreading the timestamps. She wasn't. Someone was padding the hours, and someone, at the billing department, the medical director, the hospital administration, was collecting money for work that hadn't happened. She closed the chart and continued her rounds, her face smooth, her breathing steady. This was not her unit. This was not her job. She was a new nurse at Cedar Creek Medical, 3 months in, keeping her head down, learning the system, waiting for the window to open. Dr. Mercer arrived for morning rounds at 6:06, and she smelled him before she saw him, cologne, the expensive kind that cost more than her weekly salary, something that hung in the air like a warning. He was tall, maybe 6'2", with the kind of bearing that came from knowing your family had donated the dermatology wing of the hospital 30 years ago. His hair was dark with silver at the temples, perfectly styled. His shoes were Italian leather, unmarked by the floor of an actual workplace. He moved through the ICU the way a general moved through conquered territory, with the assumption that everything here belonged to him. The other nurses straightened when he appeared. The ones who'd been sitting adjusted their posture. One of them, Jennifer, day shift charge nurse, stood up from the computer and started walking toward him with a clipboard. Brooke continued her documentation. She didn't straighten. She didn't move faster. She did her work. Dr. Mercer passed her station and then paused. She felt the pause before she heard it, the kind of hesitation that meant someone was paying attention. She didn't look up from the chart. She could feel him standing behind her, reading over her shoulder, and she knew exactly what he was seeing. Her documentation on Hartwick. The vitals, the assessment, the notes about the foresight and the lab values and the medication times. Everything correct. Everything precise. Everything exactly the way it was supposed to be. "You're the new one," he said. It wasn't a question. His voice was the kind that carried authority without effort, the kind that had never been interrupted. 3 months, Dr. Mercer. She finished writing the last digit of the blood pressure, set down the pen, and then turned to face him. Her expression was neutral, the kind of neutral that came from years of working under people who used their authority like a weapon. "Is there something you need?" "The charting." He gestured at the open chart. "Very thorough." "The facility requires it." "Yes. But most nurses at your level don't achieve this level of detail." He was studying her with a kind of attention that suggested he was assessing something. "Where did you work before Cedar Creek?" "Denver General." 5 years. It was true. 5 years before the mission, before the call that came through a Pentagon liaison asking her to take a position at Cedar Creek. 5 years of keeping her head down in a regular hospital, raising her son, doing the work that nobody watched. And before that? Different states. Travel nursing. Also true. The kind of explanation that didn't invite questions. The kind of answer that made her sound like someone running toward something instead of someone running away. Interesting. He was still holding that clipboard, still looking at her the way a man looks at something he's trying to figure out. Most nurses come to Cedar Creek because they want to stay somewhere. To build a career. To make connections. Brooke didn't answer. She turned back to the chart and continued her documentation, her handwriting steady, her movements precise. Around her, the ICU continued its constant work. The ventilators wheezed. The monitors beeped their regular rhythm. The overhead paging system crackled with a call for a trauma surgeon to the emergency department. This was the sound of a hospital running, all of its parts moving in the choreography of people trying to save lives. Dr. Mercer stood there for another few seconds, and then he moved on to room 8, to his post-op cardiac patient, to the work that actually belonged to him. Brooke continued her rounds, but her mind had shifted into the part of her training that most people never saw. The part that catalogued details. The part that noticed what was wrong. The part that had been trained, over 14 years of active service, to observe a room and understand exactly what was happening beneath the surface. Dr. Mercer was competent. That was the most dangerous thing about him. A competent man who was also corrupt was a man who would be very difficult to stop. A competent man who was also arrogant would eventually make a mistake. She just had to be ready when he did. The morning continued its usual rhythm. The night shift nurses gave report to the day shift. New medications arrived and were checked against the computer system. A new admission came in around 7:30, a septic patient from the medical floor, 58 years old, his blood pressure already bottoming out. They got him settled in bed 12, got him on pressors, got the ICU machinery hooked up and humming. Brooke helped with the placement of the central line, holding the patient's arm in the correct position while the attending physician, not Mercer, a good one named Dr. Chen, found the subclavian vein and threaded the catheter home. It was the kind of work that required precision and no hesitation. She'd done it 200 times, maybe more. Her hands knew what to do without her thinking about it. By 8:15, she had documented the morning on the new admission, sent her reports, and confirmed that all her patients' medications were correct, all their 4 lines were patent, all their monitors were reading accurately. She sat down at the computer for a moment, just long enough to call up the billing records again, just long enough to see what else might be hidden in the numbers. 3 more discrepancies. A laparoscopic cholecystectomy billed for 6 hours, surgical notes showing 90 minutes. A hysterectomy billed for 9 hours, actual time 4 hours and 32 minutes. A spinal fusion billed for 14 hours, surgery time documented as 6 hours flat. Thousands of dollars for every discrepancy. Tens of thousands per month if she extrapolated across the full patient load. And Dr. Mercer's name was on all of them as the attending physician. She closed out of the system and stood, her movement steady, her face calm. There was a folded flag in her pocket and a green beret colonel in bed 7 and 20 different doctors at Cedar Creek Medical who would probably say they didn't see anything wrong with their colleagues' billing practices. 20 doctors who would look the other way because that was what doctors did. That was what institutions did. But that wasn't the worst part. The conference room smelled of antiseptic and ambition, 20 residents arranged in perfect rows like soldiers awaiting orders. Dr. Mercer stood at the front, holding a folder the way a prosecutor holds evidence, and Brooke Sullivan stood against the back wall with her arms crossed, watching the theater unfold with the detached precision of someone who had seen far worse than professional humiliation. "This is what happens," Mercer said, his voice carrying the smooth weight of institutional authority, "when nurses forget their place." He opened the folder. Her charting. Her handwriting. Her questions rendered as accusations. "Nurse Sullivan here has taken it upon herself to question morphine dosages I've ordered. To document, and I quote, discrepancies in surgical duration. To note supply inventory concerns that are frankly none of her business." 20 residents smirked behind clipboards. Pens hovered over paper. This was the performance of hierarchy, the ritual of power played out on the smallest available stage. One of the younger residents, barely out of medical school, actually laughed. A single sound. Mercer smiled at him like a conductor approving the violinist's timing. When a nurse second-guesses a physician's medication orders, Mercer continued, moving along the front row like he was presenting a TED talk on competence, she's not being careful. She's being insubordinate. When a nurse documents inconsistencies without running them through proper channels, that is, through me, she's creating liability for this institution. He paused. The pause was calculated. She's creating the illusion of problems where none exist. For minutes. He talked for 4 minutes, detailing each of her supposed infractions with the care of someone building a legal case. The tone never rose. His voice stayed measured, controlled, which made it worse than yelling could ever be. Yelling was passion. This was contempt structured into words. Brooke didn't move. Her jaw was set like a clamped vice, but her eyes remained flat, meeting his gaze when his eyes swept the back wall, finding her. She didn't blink. She didn't shift her weight. She stood like someone who had been briefed on this exact scenario, trained for the moment when authority would try to break her in public. When he finally paused for breath, reaching for water, she spoke. Her voice came out quiet, so quiet that heads turned to hear it, residents leaning forward slightly. Strange how your criticism started the day I asked why we bill for 12-hour surgeries that last 6. The fluorescent lights hummed their constant electronic song. Someone's pen stopped writing. The room went so still you could hear the fax system breathing through the ceiling vents. Mercer's face didn't change. That was the worst part for him, his face didn't change at all. He set the water cup down. His hand was steady. "I'm sorry." But Brooke was already moving. She turned with the economy of motion that came from muscle memory deeper than conscious thought, and walked toward the door. Her footsteps echoed across the marble corridor outside, each step deliberate and unhurried. Behind her, she heard Mercer continue talking to the residents, but his voice had lost its sonorous confidence. He was talking louder now, trying to reclaim the room, trying to re-establish that this was still his theater. It wasn't working. That afternoon, Brooke stood at the vending machine on the 3rd floor, feeding bills into the slot for coffee she didn't want, just needing the motionless cover of routine. Her hands were steady. They'd been steady through worse. Much worse. But the vending machine's mechanical grinding sound had barely finished when Mercer approached from her left, close enough that she could smell his cologne, something expensive and manufactured, the kind that announced itself like a threat. He stood with his hip against the machine. "You know what I love about nurses like you." His voice was lower now, conversational, which was its own kind of cruelty. Cruelty whispered felt more dangerous than cruelty shouted. "You think 3 months of charting makes you a detective? You think you understand systems that took me 15 years to build?" Brooke took her coffee from the dispenser. The cup was hot. She held it carefully. "Security will escort you out if you ever question my orders again." He said it like he was doing her a favor, explaining a simple rule of the road. "That's not a threat. That's institutional policy. You question me publicly again, your badge doesn't work tomorrow." She turned her head and met his eyes. Not quickly. Deliberately. Held his gaze like she was looking through glass at something beyond him, something he couldn't see. Her eyes had the quality of deep water, cold, still, and infinitely deep. She didn't blink. Didn't shift. Didn't break the contact even when his jaw tightened, even when his left hand clenched slightly. 5 seconds. 10. 15. Mercer looked away first. His eyes dropped to the floor, then back to the coffee machine, as if something there suddenly demanded his attention. The scar tissue in Brooke's stomach loosened slightly. This was the thing about power, real power, the kind that came from surviving actual combat, surviving actual consequences. It didn't need to make noise. "Enjoy your coffee," she said quietly, and walked past him toward the ICU. Behind her, she heard him stand there at the vending machine, not moving, staring at nothing. The evening shift report happened at 6 o'clock. 23 nurses assembled in the conference room with Dr. Mercer at the head of the table like he was conducting an orchestra. Brooke sat in her usual seat, 3rd from the left, with her hands folded and her face arranged in professional attention. "We're making schedule changes," Mercer announced, not looking at her but aiming his words in her direction like a rifle aimed at a general target. "The ICU needs fresh perspectives. People who understand hierarchy. People who can work collaboratively with physicians rather than creating silos of resistance." He read the names. Rodriguez, transferred to cardiac care. Chang, reassigned to orthopedics. Kamal, moving to pediatrics. Each one of them a nurse Brooke had worked with, trained with, coordinated with. Each one of them someone who understood the rhythm of the ICU, the rhythm of her cover. A new name appeared on the roster, Jennifer Chen, RN, transferred from MedSurg. Brooke had seen her in the hallways, young, nervous, checking her watch constantly like the day might run away from her if she wasn't paying attention. Fresh out of nursing school. Easily managed. Easily controlled. Jennifer will be joining ICU nights, Mercer continued, his eyes finally finding Brooks across the table. "She'll be working with Nurse Sullivan. I expect the same mentoring relationship I know all our senior nurses provide." There was no emphasis in his voice. That was the brilliance of it. He wasn't threatening her with words. He was threatening her with configuration, with structure, with the slow systematic removal of every competent person in her orbit until she was surrounded only by people she had to train, had to protect, had to manage. He was isolating her the way a predator isolates prey, not through drama but through logistics. Brooke nodded once and wrote Jennifer's name in her shift notebook. That night, when they were together in the ICU at 2,100 hours, Jennifer was visibly trembling. Her hands shook as she hung for bags. She double-checked medication doses 3 times, apologizing each time. "I'm sorry, the residents were so much easier to manage." Brooke didn't say that what Mercer had done was calculated, that Jennifer's fear was precisely the point, that surrounding herself with nervous new graduates was a strategy as effective as any weapon. Instead, she showed Jennifer how to verify the 4-pump settings, how to confirm the medication labels, how to trust her training even when her confidence was shaking like a wind-chased tree. "You're doing fine," she said quietly. "Just verify twice, give once. Double-check everything." Jennifer nodded. Relief flooded her face at this small permission to be careful, to be cautious, to question systems. But that wasn't the worst part. At 0200 hours, Brooke was alone in the break room when her Pentagon-issued phone vibrated in her scrub pocket. She unfolded it, a device that looked like something from 15 years ago, deliberately outdated, designed to draw no attention. The message was encrypted: "Maintain cover. Patient protection priority 1. Fraud investigation secondary. 3 days to critical threshold. Stay operational." 3 days. She'd been inside Cedar Creek Medical for 87 days total, the first 30 as simple intake, the last 57 as embedded operative. 3 days was nothing. 3 days was everything. She deleted the message and closed the phone, standing at the window of the break room looking out at Denver at night, the city glittering like a circuit board lit from underneath. Somewhere out there, her Pentagon handler was watching satellite feeds of this hospital, coordinating with the FBI field office, preparing the extraction and arrest. Somewhere out there, her son was in his dorm at CU Boulder, not knowing his mother was working night shifts at a suburban hospital wearing a name badge that lied. Somewhere in the ICU, in Bed 7, Colonel James Hartwig remained unconscious, his vitals stable and slowly improving, his chart now marked with access restrictions. Mercer had written the orders himself, physician evaluation and ICU nursing staff only. All other personnel require authorization. Which meant if something happened to the colonel, if he crashed, if he coded, if his status changed, Brooke would be the only person with the skills to help him. And Mercer would know it. At 0400 hours, during the deepest part of night shift, Jennifer made a medication error. She was hanging vancomycin for a post-op patient in Bed 3, and she'd pulled the dose without checking the second verification form. Brooke, doing her rounds, saw the mistake before Jennifer even connected the tubing to the 4-port. "Stop," she said quietly. Not yelling. Never yelling. Just immediate, absolute authority in a single word. Jennifer froze. Her face went white. "Check the dose again." "Against the chart," Brooke said. "What's the prescribed amount?" Jennifer looked. Her hands trembled as she held the vial. "It's 1.5 grams. I pulled 2 grams. "Correct," Brooke said. The word came out like a command from someone who'd been giving them for 20 years. "Put it back. Get the right one. Verify with me before you hang it." Jennifer's eyes filled with tears, but she moved immediately, replacing the vial, pulling the correct dose, checking it twice against the original order with Brooke standing beside her, wordless. When it was correct, when the correct medication was hanging and running, Brooke simply nodded. "You caught it in time," she said quietly. "That's what matters. Verification is speed. Speed is verification." Jennifer nodded, breathing carefully, processing the fact that she'd almost poisoned someone. The next morning, during day shift handoff, Dr. Mercer reviewed the incident report. Brooke was standing across from him, hands folded, expression neutral. "Interesting," he said, scanning the document. Nurse Chen initiated the error. But it was caught. He looked up at her. "By you, apparently. Nice catch, Sullivan. That's what I like to see." Experienced staff helping the newer members develop. He made a note in Jennifer's file. Brooke saw him write it. Initiative. Require supervision. Not careless. Not dangerous. Initiative. The same word he would use to describe her own documentation of discrepancies, spun into a virtue when it applied to someone he was training and into insubordination when it applied to her. That was when Brooke understood the full architecture of what he was doing. It wasn't just about isolating her. It was about making her indispensable and simultaneously invisible. Jennifer would get the credit for initiative. Brooke would get the responsibility for oversight. And when something went wrong in the ICU, and something would go wrong, eventually, because it always did, Brooke would be the nurse standing closest to the body, holding the equipment, and Mercer would have 20 residents, 5 staff physicians, and 1 nervous new graduate ready to testify that she'd been the one moving the pieces. She folded the shift report and filed it in the chart. She didn't have 3 days anymore. She had less than that. And somewhere in bed 7, Colonel Hartwick was still unconscious, still vulnerable, still marked as restricted access only. But that wasn't the worst part. The worst part was that now Brooke understood exactly what Mercer was planning, and she was trapped in the waiting game of watching it unfold. The night shift stretched long at Cedar Creek Medical, and Brooke moved through the ICU with the deliberate precision of someone who had learned to make invisibility an art form. 11 p.m. found her at Colonel Hartwick's bedside, checking vitals with the practiced efficiency of a nurse, but her mind was mapping something else entirely: Dr. Mercer's patterns, his movements, the geometry of his deception. She'd already documented 17 instances of billing discrepancies in the surgical logs, cross-referenced them against actual procedure times, and found nothing but absences where explanations should have been. The fluorescent lights cast everything in that particular hospital white that made honest work look like a confession, and Brooke moved between the monitors and the charts like a ghost collecting evidence no one was supposed to find. By 2 a.m., Brooke had positioned herself at the supply station where the night sight lines gave her a clear view of the stockroom door. Her hands moved through the motions of restocking for supplies, her attention split between the mundane task and the corridor beyond. She'd noticed it the first week. Mercer never came to the ICU after midnight unless there was an emergency call. But on Tuesday nights and Thursday nights, without fail, he appeared. He would check the cameras, confirm the night shift skeleton crew was occupied, and then vanish into the supply room for exactly 8 minutes. The pattern was as precise as military movement, calculated, repeated, purposeful. This wasn't a doctor checking inventory. This was a man executing a schedule. At 2:17 a.m., Mercer appeared. He moved past the nurse's station without acknowledging Brooke, his white coat hanging like borrowed authority, his face the expression of a man who had convinced himself that confidence alone could rewrite reality. Brooke didn't watch him directly. Instead, she folded blankets with deliberate slowness, her peripheral vision tracking his approach to the stockroom. He keyed the door. It hissed open. He stepped inside, and Brooke began counting: 1 Mississippi, 2 Mississippi, 3 Mississippi. She'd learned to count like this in Fallujah, where timing meant the difference between extraction and ambush, where knowing how long someone stayed in a room determined whether you lived to leave it. For minutes in, she heard something that didn't belong: the unmistakable clink of surgical packs being moved, the sharp snap of sealed containers being opened and resealed. The sound was precise, deliberate, the work of someone who knew exactly what they were taking and why. Brooke's jaw tightened, but her hands didn't pause in their folding. She'd suspected the medication diversion, but hearing it confirmed was a different kind of certainty. Mercer wasn't just billing for surgeries that didn't last as long as claimed. He was removing supplies, probably pain medications, controlled substances, the kind of inventory that walked out of hospitals in doctors' briefcases and ended up on streets or in private practices that didn't ask questions. At 8:17 a.m., Mercer emerged. He carried nothing visible, but Brooke had learned in 16 years of military medicine that the smallest thefts were often the most methodical. He walked past her station again, this time meeting her eyes for half a second, a mistake, a moment where his professional mask slipped and something predatory showed through. Brooke looked away first, a tactical retreat that made him believe he'd won the exchange. She'd learned long ago that letting people think they were winning was sometimes the only way to keep them talking until you had enough evidence to end them. What happened next was worse than the crime itself. By Friday morning, Brooke arrived for her shift to find the ICU roster changed. Her most experienced colleagues, Diane who'd worked ICU for 23 years, Marcus who'd trained half the night shift staff, Susan who could read a monitor like some people read faces, were all scheduled for rotation to other departments. The new assignments weren't temporary. They were permanent transfers, effective immediately, signed by Mercer with the confidence of a man who didn't expect anyone to question his authority over staffing. The message was surgical in its precision: everyone who might corroborate her observations, everyone who had the experience to notice the pattern, everyone who could confirm her suspicions had been systematically removed from the board. In their place, the ICU roster filled with names Brooke barely recognized. Fresh graduates from the nursing program at Denver General. Newly licensed clinicians still in their first month of practice, still consulting protocols for procedures that should have been instinct by now. Mercer had done this before. She'd seen it in Afghanistan when Taliban leadership restructured cells ahead of operations, removing experienced commanders and replacing them with younger recruits who wouldn't ask questions and couldn't recognize danger when it arrived. The parallel was so stark it made her breath catch. He was building an ICU where he was the only experienced clinician, the only one qualified to make decisions, the only voice that mattered. By Saturday night, Brooke was the only RN on the ICU floor with more than 2 years of experience. The 20-bed capacity was fully staffed. Mercer had ensured that much, but 19 of those staff members had less than 6 months of independent practice. They deferred to her for guidance, which meant Brooke was now handling the workload of 3 nurses while documenting every decision, every intervention, everything that could be weaponized against her when Mercer decided to tighten the noose. She understood the strategy now. He wasn't going to fire her quietly. He was going to let her make a mistake, or more likely, he was going to create the circumstances where one became inevitable, and then he would destroy her professionally, publicly, with every newly graduated nurse in the ICU as a witness to her incompetence. She moved between beds with the mechanical efficiency of someone running on muscle memory and determination, her voice calm as she directed the younger nurses through assessments. Around her, the ICU hummed with the rhythm of monitored illness, ventilators wheezed their mechanical breathing, pumps beat their precise intervals, monitors displayed their endless cascades of numbers that meant everything to people who knew how to read them. Brooke read them in 3 languages now: English numbers, the vital signs of bodies in collapse, and the silent language of evidence she'd been collecting for weeks in a locked file on an encrypted drive that her phone would auto-delete if she didn't input the correct code every 48 hours. She was a spy in her own profession, and the irony of that wasn't lost on her. In bed 7, Colonel Hartwig remained unconscious, his Baghdad injuries healing with the stubborn resilience of a man built by selection and hard experience. His wife hadn't visited in 4 days. Mercer had mentioned to Brooke that the family visits were disrupting the patient's recovery protocol, another small cruelty disguised as medical judgment. Brooke knew the real reason. Mercer didn't want family present. Family asked questions. Family brought authority figures who understood chain of command and medical negligence and the kind of documentation that lawyers fed on. Family complicated his narrative. So Mercer had gently, professionally discouraged the visits, and now the colonel lay in the ICU with only the night shift nurses and the machines bearing witness to his healing. Brooke had positioned herself as indispensable to his care, not through any dramatic intervention, but through the simple discipline of excellence. She knew his medication schedule better than the pharmacist. She recognized the subtle changes in his lung compliance from the ventilator graphs. She'd caught a minor infection marker in his white cell count that the day shift had missed, had it treated before it became complicated. The colonel didn't know her name beyond the badge that read RN Sullivan, but his body was healing under her hands, and that counted for something in a world where Mercer was systematically dismantling everyone else's credibility. By the second Tuesday, the pattern had solidified. The newly graduated nurses looked to her for guidance. Mercer had built his isolation strategy perfectly. He'd made her simultaneously essential and vulnerable, the most experienced person in the room and the obvious scapegoat if anything went wrong. The trap was elegant in its construction, and Brooke recognized it because she'd seen similar tactics used by commanders who wanted to break a soldier's morale. Put them in charge of a failing mission. Give them responsibility without authority. Surround them with people they have to protect. Then watch them break when the inevitable failure comes. But that wasn't the worst part. The worst part was that at 2,130 hours on Tuesday night, as Brooke conducted her assessment of Colonel Hartwick, his chest looked wrong. She placed her hands on both sides of his rib cage. One side wasn't moving with the normal expansion of breath, and the asymmetry made her hand still for exactly 2 seconds before muscle memory took over. His oxygen saturation read 94% on the monitor, but the numbers didn't match what her clinical judgment was screaming. She watched it drop, 92, 88, 84. The monitor beeped faster, a sound like a fist hammering on glass from inside the chest cavity. The monitor screamed. Oxygen saturation dropping like a stone down a well, 92, 88, 84, the numbers crimson on the display. Colonel Hartwick's chest rose on the left side, collapsed inward on the right. Asymmetrical. Wrong. The kind of wrong that meant minutes, not hours. Brooke was at his bedside before the alarm finished its first cycle. Her hands moved across his ribs, palpating, feeling the air where it shouldn't be, trapped between the lung and chest wall, pressure building like a bomb in a sealed room. Tension pneumothorax. She'd seen it twice before in Baghdad. Both times, the patients coded within 4 minutes if no one intervened. "Call Dr. Mercer," she said to the night nurse, a recent graduate named Tasha who looked like she was watching the ceiling lights instead of the monitor. "He said he doesn't want to be called for vitals changes. Only for." "Call him. Now." Tasha's fingers fumbled the phone. Mercer answered on the second ring, his voice already irritated, already dismissive. "What?" "Colonel Hartwick's oxygen saturation is dropping," Brooke said, her voice level, controlled. 84% and falling. Asymmetrical chest wall. "I'm assessing for tension pneumothorax." The silence on the line lasted 2 seconds. "Then, get a chest X-ray." "Stat. We'll wait for radiology confirmation before we do anything. His O2 is dropping too fast. If this is pneumothorax." "I said we wait for imaging." The line went dead. Brooke's jaw tightened. 81% now. The colonel's heart rate climbing toward 140, his body starting to shout in the language of shock. Every second the trapped air pressed harder against his lung, collapsed it further, pushed his heart toward the midline. She'd seen the progression before. She knew exactly how this movie ended if nobody intervened. She moved to the crash cart, the metal cabinet with its arsenal of needles, tubes, and drugs that lived in every ICU. Her fingers found the 14-gauge angiocath needle in the red compartment, the one designed for emergency decompression. The plastic casing felt solid in her palm, familiar as a prayer. Dr. Mercer arrived 4 minutes later, moving like a man who'd been pulled from something more important. He looked at the monitor, looked at the colonel, looked at Brooke. "Radiology is backed up. Could be 15 minutes. 78%, Brooke said quietly. Then we manage his oxygen. Bag him if necessary. But we do not proceed with invasive intervention based on clinical suspicion alone." The fluorescent lights buzzed overhead like insects. 76% now. The colonel's body stiffening, his nervous system recognizing the pressure, the hypoxia, the cascade of dying that was beginning in his tissues. Brooke didn't ask permission again. She moved to the bedside, her hand steady as surgical lasers, steady as someone who'd done this before in places where there were no doctors, no radiology departments, no bureaucrats discussing protocol while patients coded. She swabbed the second intercostal space with chlorhexidine, the acrid smell of antiseptic rising between them, and positioned her fingers between the ribs, finding the landmarks in her mind: midclavicular line, second space, the thin corridor where a needle could reach the collapsed lung and release the pressure building like water behind a dam. "What are you doing?" Mercer's voice cut sharp as a scalpel. "Step away from that patient." "I'm documenting this insubordination," he said, pulling his phone from his pocket, his hand shaking with something that might have been rage or might have been fear. It was hard to tell the difference when a nurse in scrubs was about to do something he'd forbidden. Brooke didn't step away. She didn't hesitate. She didn't flinch at his words or his phone or the way he moved toward her with his arm extended, his hand reaching for her wrist. Her body knew its own priorities. The patient's survival was first. Everything else was noise. She felt Mercer's fingers close around her wrist, his grip tight, almost desperate, his skin hot and damp. "Security," he shouted toward the door, his voice cracking on the second syllable. "I need security to this unit immediately." Brooke pulled her arm free with a move her combat instructor had drilled 1,000 times, a simple rotation, a turn of her hips, a gesture of such economical violence that Mercer stumbled backward, his grip breaking like tissue paper. She didn't push him. She just extracted herself, the way water escapes a closing fist. The needle went in. Between the second and third ribs, through the intercostal muscles, through the pleural space. She felt the resistance give way, the distinct tactile feedback that meant the needle was in the right place. And then the sound that made everything else irrelevant. A hiss. The sound of trapped air escaping, like someone opening a pressurized valve, like wind rushing out of a sealed chamber. The needle was barely deeper than her fingernail and the air came rushing past the catheter in a steady stream. The hiss continued for 3 seconds, 4, 5, pressure releasing, the lung expanding, the cascade of dying stopping mid-motion. Brooke watched the monitor. 76. 79. 82. 87. 91. 95. Colonel Hartwick's chest wall equalized. The right side rose now in synchrony with the left. The symmetry returned. The breathing became easier, almost peaceful. His heart rate began to climb down from its panicked peak: 140, 135, 128, 120. The room went dead silent. Not the absence of sound. The presence of silence so thick you could cut it with a scalpel. 20 doctors had witnessed the needle decompression, the residents from grand rounds, the attending physicians, the medical students who'd been assigned to Colonel Hartwick's case. They were all there, standing in the doorway, their clipboards forgotten, their eyes on the monitor watching the oxygen saturation climb back toward normal. Dr. Mercer's face was the color of hospital bleach. His pupils were dilated, his mouth opening and closing like a fish, like his brain was generating words his vocal cords couldn't produce. For 5 full seconds, he looked exactly like what he was, a man who'd just watched his authority dissolve in front of 20 witnesses, who'd just watched his explicit order get violated in the clearest possible way, who'd just watched a nurse save a patient using the exact intervention he'd forbidden. Then his expression hardened. The fear crystallized into rage. His jaw clenched so tight the muscles stood out like cable beneath his skin. "Everyone out," he said, his voice quiet and terrible. "Now." The 20 doctors filed out in silence. No one questioned. No one hesitated. The authority in his voice was different now, not the authority of institutional power, but the authority of a man with nothing left to lose, which made him infinitely more dangerous. Brooke secured the catheter with tape, her hands moving through the ritual with the same precision she'd shown during the insertion. Professional. Composed. Not acknowledging the fact that she'd just blown her cover to pieces, that she'd just violated a direct order from the hospital's most powerful physician, that she'd just chosen a patient's life over her mission, her career, her ability to maintain the cover that was supposed to protect Colonel Hartwick for the next 6 weeks while the Pentagon investigation continued. She disconnected the needle and secured the catheter with a sterile dressing. Checked the lung again with her stethoscope, feeling the air movement return symmetrically on both sides. The colonel's color was improving already, the gray tinge receding from his lips, his oxygen saturation settling at 96%. In the hallway, Dr. Mercer's voice came through the door, sharp, clipped, making phone calls. First call, the chief of staff, the one who owed him favors for covering up a patient death 5 years ago, a surgical complication that should have ended his career. Brooke could hear Mercer's voice through the wall, measured now, controlled, building his narrative. There's been an incident with nursing insubordination. A willful violation of direct orders during patient care. I need to document this officially. Second call, the nursing director, the one whose son's surgical residency Mercer was sponsoring, the one who'd learned early that keeping Mercer happy was better than enforcing actual policy. The same conversation. Different words. Same message, we have a problem with Nurse Sullivan. Third call, hospital security. Brooke didn't hear all of it. She didn't need to. She knew how this would end. She'd seen institutional power before, had watched it move through systems like bacteria through a petri dish, had learned 100 different ways that competent people could weaponize bureaucracy against someone who'd threatened their authority. By midnight, 2 security guards arrived at the ICU. They weren't unfriendly about it. They just deactivated her badge, asked her to collect her personal belongings, and stood nearby while she emptied her locker. 3 weeks of scrubs, 2 pairs of shoes, a photograph of Marcus at 14 in his ROTC uniform, a small framed print of a verse from Psalms that her mother had given her in 2006. The guards walked her to the loading dock. At 2 in the morning, Brooke stood alone in the hospital laundry room, the industrial washers humming around her like a choir of ghosts. The fluorescent lights cast everything in clinical white. The air smelled of hospital detergent and heat and the faint chemical ghost of bleach. She folded her scrubs one last time, the fabric still warm from the dryer, each fold precise and deliberate, the ritual performed hundreds of times that was now being performed for the last time. Her ID badge lay on the table beside her. Cedar Creek Medical. Captain Brooke Sullivan. The photograph they'd taken on her first day, the careful neutrality of her expression, the way she'd positioned her face to look deferential, competent, unthreatening. All of that work. All of that performance. All of that sacrifice collapsing because a Green Beret colonel's oxygen saturation had dropped and she couldn't choose the mission over the patient. She laid her badge on top of the folded scrubs, the plastic rectangle looking like a tombstone in the fluorescent light. The mission was compromised. The cover was blown. The fraud investigation would have to be handed off to someone else, someone who didn't have a relationship with the unconscious patient in ICU bed 7. Colonel Hartwig would have to be protected by someone else. The 20 doctors who'd watched her needle decompression would carry that image in their minds, that moment when a nurse had violated protocol and saved a life, and none of them would be able to explain why they hadn't reported her faster, why they'd all stood in that doorway watching instead of stopping her. She placed her folded scrubs in her bag. The badge went into her pocket. She turned off the light. The loading dock entrance was lit by a single amber light, the kind that attracted moths and made everything look like the last frame of a film noir. Rain was falling, the kind of rain that came to Denver in early June, cold and sudden and honest. Brooke stepped into it without hesitation, let the water soak her scrubs, let the night swallow her whole. Behind her, Cedar Creek Medical continued its work. The ventilators wheezed their mechanical rhythm. The monitors beeped their digital song. Colonel Hartwig lay unconscious in ICU bed 7, his chest rising and falling with symmetric rhythm now, his oxygen saturation stable at 96%, his life preserved by a decision that had cost her everything. Muscle memory took over. She walked to her car. She drove to the safe house where the Pentagon had rented her an apartment 3 blocks from the hospital. She showered in the dark, letting the water wash away the smell of antiseptic and institutional power. And then she sat on the edge of her bed at 3 in the morning, staring at her phone, waiting for the call she knew was coming, knowing that the next 24 hours would determine whether her cover could be salvaged or whether the entire operation had just collapsed into the kind of chaos that ended careers. The phone didn't ring at 3 in the morning. It rang at 4:56, and Brooke was already awake, staring at the ceiling of her apartment, waiting. She didn't answer. She knew exactly what that call would say, and knowing was sometimes better than hearing it. By the time she arrived at Cedar Creek Medical for what she thought would be her shift, her badge no longer worked. The scanner at the employee entrance beeped once, a sound like a judge's gavel, and red text flashed on the display, "Access denied." She stood in the lobby for exactly 43 seconds, watching other nurses swipe through without looking at her, and then she turned around and walked back out into the Denver morning, where the air tasted like diesel exhaust and ended dreams. The first phone call had come within an hour of Colonel Hartwick's O2 SATS stabilizing. Dr. Mercer had stepped into the attending's office, closed the door, and made that call to Chief of Staff Harrison, the one who owed him favors from the Davenport surgical suite renovation Mercer had personally financed. The second call went to Director Chen at Nursing, whose son's residency sponsorship depended entirely on letters of recommendation from the Department of Surgery. The third call was to hospital security, a simple statement, "I need that problematic employee's access terminated by midnight." Full documentation of insubordination, unauthorized clinical decisions, and risk to patient safety. I'm prepared to testify to all of it. By 11:41 p.m., Brooke's badge had been deactivated. By midnight, security had cleared her locker. By 2 a.m., standing alone in the hospital laundry with the industrial washers humming their mechanical dirge around her, Brooke folded her scrubs for the last time. The fabric was still warm from the dryer, soft in her hands, and she laid each piece carefully in the cardboard box, the blue one she'd worn for 12-hour shifts, the white undershirts, the compression socks she'd bought for her feet. On top of everything, she placed her Cedar Creek Medical ID badge, and the simple gesture felt like laying down flowers at a grave. The mission was compromised. Her cover was blown. And worse than either of those was the fact that she couldn't explain to anyone why losing this particular nursing job meant more than her entire career. It meant that a decorated officer would spend weeks with someone else monitoring his drains, someone who might miss the subtle signs of infection, someone who definitely wouldn't catch the next thing Mercer was planning. She drove home in the dark. The rain came at 3 a.m., hammering her windshield like machine gun fire, and she didn't turn on the wipers until she could barely see. Rain in Denver in autumn meant something cold was coming, and she could feel it in her shoulders, in the way her hands gripped the steering wheel at exactly 10 and 2, the way a soldier grips things, with intention, with control, with the knowledge that letting go meant falling. The next morning arrived before she was ready for it. She'd slept for hours, woken up at 5:30, showered in water so hot it left her skin red, and was standing in her kitchen drinking black coffee when her phone lit up with a message from Marcus, "Mom. Dad called. He said something happened at Cedar Creek. Are you okay?" She didn't answer. She never answered his questions about work. That was the protocol, the agreement they'd made when she took this assignment. Keep her son separate from the operation. Keep him safe. But at 7:15 a.m., her phone rang again, and this time it was Marcus himself, his voice tight with something that sounded like fear, and he said, "Mom, I need you to listen. I'm coming to pick you up. I'm bringing something. Don't ask why. Just trust me." 43 minutes later, Marcus pulled his truck into her apartment parking lot. He was wearing his school clothes, jeans and a jacket with the engineering club logo on the shoulder, and his hands were shaking slightly as he held the shadow box. The wood was dark cherry, the glass pristine, and inside were the things she'd locked away in her storage unit for 18 years. The silver star first, the ribbon a slim stripe of blue and white and red. Below that, the two bronze stars, each one smaller, each one representing a decision made in the space between heartbeats. At the bottom, the combat action ribbon, which meant she'd been where bullets were flying, meant she'd chosen to stay anyway. Marcus didn't say anything. He just held the box and looked at his mother like he was seeing her for the first time. They drove to Cedar Creek Medical with the shadow box resting on the back seat like an open casket. Marcus didn't explain what he was doing. He just walked into the building with her, past security, past the front desk staff who were now staring, into the elevator, up to the ICU on the 4th floor. When the doors opened, the unit looked different, busier, filled with an energy that hadn't been there yesterday. A man in a 2-star general's uniform was standing outside Colonel Hartwick's room. A woman in a dark suit was holding a federal credential. And inside bed 7, Colonel James Hartwick's eyes were open for the first time in 14 days, and they were fixed directly on Brooke with the kind of recognition that came from knowing exactly who she was. Marcus walked directly to the bedside and opened the shadow box. The morning light coming through the window caught the medals, and they threw tiny rainbows across the ceiling. A man in dress blues, Marine Corps liaison, the insignia said Captain, stepped forward, and his voice when he spoke was formal, ceremonial, the kind of voice used only at promotions and funerals. "Captain Sullivan," he began, and Brooke felt the air in the room shift the way it shifts before lightning strikes. "For conspicuous gallantry during Operation Phantom Fury, you led a combat rescue under hostile fire in Fallujah, Jolan District, personally extracting 12 wounded soldiers from an active engagement zone. You were struck by shrapnel from an IED. You continued the mission." He paused, letting each word land like a judgment. "Silver Star." Then he continued, and with each medal he announced the facts: the Bronze Star for the convoy operation in Helmand Province, the second Bronze Star for the extraction at Sanjin Valley, the 2 Purple Hearts that meant she'd bled for this country in 2 different war zones. Colonel Hartwig reached for her hand, and when his fingers closed around hers, they were shaking in a way that suggested he'd been waiting for this moment his entire recovery. That was when Dr. Mercer appeared in the doorway. He'd been waiting somewhere, monitoring, preparing his strategy. His mouth opened to say something sharp, something about hospital property and manufactured credentials and a completely fabricated narrative, but the 2-star general who'd been standing quietly by the window turned his head, met Mercer's eyes, and then walked directly across the room to Brooke. The general saluted. Not a casual gesture. A full, formal salute. Eyes forward, spine straight, hand coming up with the kind of precision that was learned through decades of service. He held that salute for 3 seconds, his uniform a wall between Mercer and everything the medals represented. When he lowered his hand, he didn't say anything. He didn't need to. The FBI agent moved then, a woman with dark hair pulled back in a style that suggested military service, and she asked a simple question, "Dr. Mercer, I'm Special Agent Vance. Is there somewhere we can discuss your pharmaceutical procurement protocols?" It wasn't a request. Mercer's face went grey in a way that suggested he suddenly understood he'd made a terrible miscalculation. A man walked in behind Vance, 50s, compact, military bearing, with a tattoo visible on his forearm that showed a submarine conning tower wrapped in ivy. This was Tom Reeves, IT security, and he carried a hard drive like it was a weapon, because it was. "Dr. Mercer," he said, his voice carrying the accent of someone from the Midwest, someone raised in small towns and bigger responsibilities. "At 0317 this morning, you attempted to delete video files from the security system. The hospital's data recovery protocol flagged the deletion attempt and notified me automatically. I preserved the files." Reeves handed the drive to Agent Vance. The footage shows Dr. Mercer in the pharmacy at 0241, removing medication vials from the locked cabinet using credentials that shouldn't have given him access. It shows him in the supply room at 0312, altering the labels on controlled substances. Vance opened a laptop, and the room fell absolutely silent, the kind of silence that happens when people are watching their entire future get rewritten on a screen. It also shows Dr. Mercer in Colonel Hartwig's room at 0145 last Tuesday. Vance continued, her voice level, factual, devastating, adjusting the ventilator settings to restrict oxygen flow to critical levels. "You didn't know Captain Sullivan had already performed an emergency needle decompression. You didn't know she was the only person in this hospital qualified to catch what you were doing. You tried to kill a decorated officer, Dr. Mercer. That's attempted homicide. That's conspiracy against a federal witness." Mercer's lawyer arrived at 9:48 a.m., a woman in a grey suit who took one look at the laptop screen and immediately started making phone calls. By noon, Mercer's medical license was under emergency suspension. By 5 p.m., the hospital's legal team had filed a separate action to protect the institution from liability. By the following Monday, the nursing director who'd recommended Brooke's termination had submitted her retirement papers, effective immediately. The chief of staff took what was officially called a medical leave and never returned. Mercer's assets were frozen within 48 hours, the house in Cherry Creek, the $400,000 boat that had been registered to his wife's shell company, the offshore accounts that the Pentagon's financial investigation team had been tracking for 3 months. They'd known. From the moment Brooke filed her first report, they'd known, and they'd let her work the operation anyway, knowing she could handle it, knowing that a decorated officer's life was safer in her hands than it would be in anyone else's. Colonel Hartwick was conscious by the end of the week, asking for Brooke by her rank instead of her name, which meant he'd been briefed on the full picture. He gripped her hand. This was on day 3 of his recovery, when he could hold things without his grip shaking, and he said something simple, "Your son. He's going to be extraordinary." Brooke smiled, because she knew he was right, because Marcus had carried that shadow box with the same careful precision she carried a syringe, like he understood the weight of what it meant. She didn't tell him that Marcus was already talking about enlisting, already looking at rangers, already following in the footsteps of a mother he'd just discovered was made of something much stronger than hospital protocol and compassion. 6 months later, Brooke drove through Colorado Springs on a Tuesday morning, her hand steady on the wheel of her civilian car, a folded flag on the passenger seat beside her. The flag had been carried by Colonel Hartwick's team, and it had covered the casket of a man named James Chen who died in Fallujah 9 years ago. His widow had been waiting for this moment, had asked, every single day, whether someone was coming, and Captain Brooke Sullivan was finally able to say yes. She passed Cedar Creek Medical on the way, and she didn't slow down. She didn't look at the building where she'd been a nurse for 3 months, where she'd been terminally underestimated by 22 different physicians and administrators who'd seen only what she wanted them to see. She passed a community college campus and saw, through a ground-floor window, Dr. Mercer teaching CPR to a classroom of court-ordered participants, felons completing mandated certifications, earning minimum wage, his license permanently revoked, his career converted to minimum wage instruction for people who had nowhere else to go. She didn't slow down for that either. The house was on a tree-lined street in the older part of the city, and Mrs. Chen was waiting on the porch. She was 74 years old and had spent most of her waiting for her husband's flag. Brooke carried the shadow box, the one that contained the same medals Marcus had seen, the same proof that some people sacrifice everything and that some people spend their lives making sure that sacrifice meant something. She presented the flag with full military honors, the words coming out exactly as she'd rehearsed them 1,000 times in the dark hours of her assignments. Mrs. Chen took the flag and pressed it against her chest, and she cried, and Brooke stood with her while the Colorado sun moved across the lawn. The drive back to Denver took exactly 2 hours and 43 minutes. Brooke had her permanent nursing license now, her cover identity had been quietly converted into real credentials, which meant she could work anywhere, anytime, no more pretending. The Pentagon had already called about a new assignment, a hospital in Northern Virginia, another investigation, another cover, another chance to be the person no one expected to be the strongest person in the room. She answered the call while she was still driving, while the Rocky Mountains were disappearing behind her in the rearview mirror, and her voice when she spoke was steady and low and carried the weight of someone who'd already survived the worst the world could offer. "Captain Sullivan," she said. "Ready for deployment." Her apartment was waiting, and in her closet hung both sets of clothes, the scrubs and the combat boots, the civilian nursing shoes and the tactical gear. The badge lay on the counter, proof of who she'd been for 3 months. The medals were back in storage. Her son was graduating high school in December and talking about enlisting, which meant the cycle would continue, meant the next generation was learning what Brooke had always known: sometimes the bravest warriors don't carry guns. Sometimes the bravest warriors carry stethoscopes and the kind of quiet certainty that comes from knowing exactly what your hands can do, exactly who you are, exactly what you're willing to sacrifice for people who will never know your name. Remember the people around you, or the nurse, the janitor, the quiet person in the corner, because you genuinely have no idea who you're standing next to. Subscribe, like, and comment below. Tell us, have you ever been underestimated by someone who didn't know your true value?